A very common ailment that I see in my clinic, and it comprises approximately 2/3 of what I see, is back and leg pain. Most often the reason for this is a degenerative disc condition that occurs of the spine. Now, degenerative disc disease that occurs of the spine is just a natural process. In some patients it occurs quicker than in others. That can be a hereditary factor. It can be exacerbated or accelerated by smoking, obesity. All these factors lead into the conditioning worsening quicker over time. What we tend to do for these kind of patients is that they have first been seen most likely by primary care physician who has ordered oral narcotic medications which may help their conditions, help them tolerate it. They've ordered them to stay home from work. They may give them some muscle relaxants to help them. What we tend to see in our clinic at this stage when they come to us is that they're in need of epidural steroid injections. The idea behind performing these injections is to coat the nerve roots, the discs, the ligaments of the area of the back that is inflamed, and calm down the inflammation of these areas, reducing the pain symptoms. If we're able to accomplish the reduction in pain symptoms in these patients during this period of time for 2, 3, 4 months at a time, and they don't have a good surgical option for them, then it's quite safe to continue to receive these epidural injections on an ongoing basis. A lot of these patients have a very limited lifestyle because of the pain in their back or legs from this disease process, and I treat patients in my clinic on a daily basis who have this condition, and they continue to do well on an ongoing basis receiving these. They're able to function better and take less oral pain medication as a result. Another common symptom that I've related to already is sciatica, which is the occurrence of leg pain as a result of a degenerative disc or an irritated nerve root condition of the lower spine. Sciatica is best treated by a transforaminal epidural steroid injection or by a selective nerve root block, which will help calm down the inflammation of the nerve tract involved. When I first see a patient who is bothered with sciatica, I get detailed information in their history about exactly which leg and what part of the leg is involved. I can then look at their MRI findings and correlate exactly what level needs to be injected and what nerve roots need to be coated with a steroid solution. Patients generally respond very well to this. That, like degenerative disc disease and back pain, they often will need ongoing injections. 1 or 2 injections may take care of their problem for a period of time. There are a host of other patients that I see that need to have these injections on an ongoing basis throughout the year. But again, they're able to increase their function, take less pain medication by receiving these selective nerve root blocks. Another large part of my patient population comprises people who have upper extremity pain and upper back or neck pain. For this condition, just like with the lumbar epidural steroid injections and the lumbar transforaminal epidural steroid injections, I can offer the same site injections for the cervical region. What I find is that patients who are bothered with this type of a condition can receive 1 or 2 of these injections and often get benefit from that. What I also have to do in many cases, the patients have chronically irritated nerve roots that need to be injected 2 or 3 times a year. And by doing this, we're able to decrease the amount of inflammation that they have and increase their function, just like we can with the lower extremity injections. There are a variety of reasons for low back pain. It can involve the facet joints, which are the joints of the lower spine. It could include the facet joints, which are the joints of the entire spine. Most likely we see a problem occurring in the lower spine. A common symptom of facet joint pain is when a patient has pain with extension of the back, pain that is worse when standing or walking for extended periods of time, and is generally relieved by rest in a sitting position. We are able to inject medication into the facet joints and find out if that is in fact the cause of their problems. The first time I do this procedure on a patient, it is truly a diagnostic block to see if this is where the pain is coming from. Anytime you can center in more on where the pain is coming from and selectively block those nerves, the patients are going to have a greater degree of benefit and receive less medication overall. If they respond well or favorably to a diagnostic facet joint block, then there is a procedure that we can perform in the clinic that is called radiofrequency ablation. What that involves is a selective nerve burning, is what I call it, of these facet joint nerves that are leading into the joints that are inflamed. We can selectively burn that nerve and provide the patient with pain relief. It's one of the few procedures in my clinic that I can perform this radiofrequency ablation on, because these nerve endings that go into the facet joints are only a sensory nerve. In other words, I could not perform this injection on a sciatic nerve injury, because those same nerves are responsible for any of the movement and feeling of the entire lower leg. So if I can isolate the very small nerve that goes into the facet joint, perform the radiofrequency ablation, it generally takes about 6 months to 9 months for that nerve to regenerate and cause symptoms again. One other point to make about facet joint arthritis is that it can also occur commonly in the cervical region. I have a host of patients in my clinic who have neck and shoulder symptoms, and often in my clinic I'll start with simply myofascial or trigger point muscle injections to see if it will calm down their problem. If after 2 or 3 injections they don't respond in more of a sustained manner, it's most likely that the common problem is the facet joint. We can then perform the diagnostic block in the cervical region as well, on either the left or right side of the neck, whichever one is bothering them the most. And if that responds favorably to the diagnostic block, they would be subject to radiofrequency ablation. Again, they would receive that and respond favorably, hopefully for 6 to 9 months after that procedure, at which time it takes the nerve that length of time to grow back into the joint.